Are you ready to have your spine crack, pop, and adjusted in ways you've never imagined? If that's what you're expecting from chiropractic, let me set the record straight. You're in the right place. We do it all here. If you're looking for an off-the-wall chiropractor like what you've seen on YouTube, you got it. I do all the classics, the no-look adjustment, the one-hand adjustment. I'm even working on a WWE adjustment if I can get some of the kinks worked out on that one. But seriously, let's talk about chiropractic and what it really means and how it can be a game changer for you. Most people don't really know what chiropractors do, and I get it. There's a lot of variety out there and it can be really confusing. So let's break it down. In a nutshell, there's three types of chiropractic offices. There's a quick fix office. This is your classic in and out approach. You walk in, you tell them where the pain is, they adjust you, and you're out the door in about 5 minutes. This works for quick, new problems like a brand new injury. Then there's a multi-therapy office. These offices, you'll get more thorough exam, maybe some stretching, some traction, maybe electrical stimulation or ultrasound. Basically, you get a mix of treatments to tackle recent injuries as well as older problems. Both of these methods are great for newer issues, like that car accident you had a month ago or a strain from the gym. And guess what? They often work wonders. I've seen patients who were stiff, nervous, and in terrible pain walking out feeling 90% better. I love treating this phase of care with people. But here's the thing. This approach rarely fixes chronic, long-term problems. That's where corrective chiropractic comes in. Corrective chiropractic is what we do in our office. We use a first visit to dig down and find out the root of your problem. We do an exam, and after that we take x-rays. These aren't your typical x-rays where we're just looking for pathology, meaning breaks, dislocations, things like that. These x-rays we use to actually find out why you have this pain in the first place. We do that by plugging your films into a software program which compares the shape of your spine with a healthy normal. This is the most important thing we do to figure out why you have the problem in the first place, and it tells us what we need to do to help you. Now, I'm really big on patient education, so I'm going to teach you what your spine is supposed to look like. Now, if you're coming to the office soon, I want you to pay really close attention to this process. I'll still go over it with you in detail because I want you to get it and understand why you have the problem in the first place and why it's so critical we change the shape of your spine. And if you're out there in YouTube land and you have neck pain, back pain, or headaches, pay close attention to this part too. I want you to understand how different a chiropractor will assess and then treat your problem based on your x-rays. So because after all, if you've had treatment consisting of medications, injections, or massage, you've never had anything like this before. And when we can do something completely different than what you've already had, there's huge potential there for improvement. Let's dive into x-ray analysis. You ready? It's a lot of information, so my apologies. So starting from the front, it's sort of a no-brainer. Looking at the neck, everything should be in a straight line. If your head is off to one side or the other, you can understand how that'll cause pain as well as wear and tear. The mid-back should be straight up and down as well. This region may show a scoliosis, and if you have that, you'll be able to see it. Now, with the low back, we should see the legs are of even height and the spine should go straight up and down just like the other regions. Again, any deviation to the side will be visible, and you can imagine that it'll cause uneven wear and breakdown. The next part is even more important, and if you've had back pain for years and years, or that neck pain, that pain just inside your shoulder blade, the one where you use a foam roller, use a lacrosse ball, Theragun, you get massages, but nothing works, I will literally guarantee you that we are going to see the cause of this problem on the side film of your spine. The side view of the neck should show that the top bone in the neck is directly above the base of the neck, and an ideal curve is actually a 42-degree arc. If you have a straight neck and a forward head, you will have that pain, guaranteed. The muscles, they never get a chance to rest, and the lower part of the neck will start to break down. And that's exactly what we need to fix. This is why I'm big on education, because you need to know what's going on so that you're empowered to fix it. The same concept holds true for the side view of the mid-back, except we tend to find most long-term thoracic spine pains, they stem from too much curve, which we call kyphosis. So if you're hunched over, you can imagine you're going to get that mid-back pain that never goes away how many times you foam roll or massage it. In the lower back, people tend to get disc breakdown in the lower segments, and we'll be able to show you that. We normally see a loss of curvature right down at the bottom of the spine, and this problem is what causes the disc breakdown. Now, we go over all this thoroughly with our patients because changing the spine takes time. It's like braces and teeth. It takes months to change it. So those are really strong ligaments holding the spine together, and just like teeth, it takes a while to remodel things. Suffice it to say, doing a few stretches and trying to sit up tall will not change the shape of your spine. It just won't. Neither will stretching your chest muscles and strengthening your scapular stabilizers. We'll go over the specifics in a future video, but the quick version is that treatment is a combination of adjustments, exercises, and these very specific specific remodeling traction methods. Aside from covering the different types of offices, the next biggest question I get, or even some hesitancy, is that people are nervous about being adjusted. And it's okay, I got you. Before I was a chiropractor, I was a physical therapist. And believe me, I used to think chiropractors were quacks and that they hurt people. Now I can look back and laugh at myself for thinking that, but a lot of people are a little nervous about chiropractic. And if you're one, I want you to watch this next video. I'm going to cover the different types of adjustments, some of the tools we use, and also let you know that if you see a chiropractor and absolutely don't want to get cracked, that's okay. Our job is to get the bones of the spine moving better, bottom line. And if you're the nervous type, this is great news. We can still achieve great results even without the cracking and popping. So if you found this video helpful, make sure to give it a thumbs up and subscribe for more. And don't forget to hit that bell so that you're notified when we release our next video, where I'll walk you through the different types of adjustments and tools we use in chiropractic care. Until next time, take care of your spine. It's the only one you got.